genomics are playing a greater role in the treatment of Waldenström's. And in fact, we've seen a lot of evidence over the years, but at this meeting, we saw a lot more, which I think is quite important. MYD88 is one of the most important mutations we have in this disease. Over 95% of patients have it. But there's also that small 5% that don't have it. And these patients tend to not do as well, except, as we're hearing, the use of zanubrutinib may be a particular targeted therapy for this population. CXCR4, this is a mutation found in over half of patients with Waldenström. And as we're hearing at this meeting, they may be particular beneficiaries of not only BTK inhibitors like zanubrutinib, but also bendamustine-based therapy. The PHILO study was updated from France, which was a long-term study looking at the benefit of bendamustine and rituximab in untreated patients. And what did we find? Well, the CXCR4 mutation could be negated even with long-term follow-up. And so this may be also an opportunity for treating these patients that carry the CXCR4 mutation. And what's also emerging that's quite important here is the role of TP53 alterations. There's in fact a consensus panel that's dedicated to these high-risk patients and how we're better off managing them. So as time has gone on, TP53 has become more and more important in the care of patients with Waldenström's macroglobulinemia.